Thank you, Mr. President. I want to join in on Councilman Squilla, and I know Councilman Kenyatta Johnson. We've done a lot of work over the last decade and definitely over the last 3 years as this opioid addiction has gotten out of control. And it's very concerning when we send competing messages or contradictory messages. On the one hand, we want to meet people where they are. We want to destigmatize this issue. We want to talk about, well, some of us want to talk about the injustices about how this problem is dealt with when the majority of the folks affected were white versus when it was black and brown people. All of those nuances to this discussion. And the one thing I've always appreciated about Councilman Squilla is that he's always been open-minded, and we've attempted to be very open-minded in this process. I was practicing harm reduction before it became the term. I took a needle exchange program that was in a van, put it in a building, worked with the community, we educated the community, we informed them, and we created a full-fledged clinic. We asked the community, we have a homeless addiction problem. We worked with the community, we had many meetings, and I can tell you some of those meetings were very difficult. Councilman Squilla and I sat there, we took it, we worked with folks, and the administration promised the community that they were going to take care of all of the issues around the respite centers. All of the community has, in one way or another, in their families, have experienced the issues around opioid addiction, having lost someone in their lives. And they told us, okay. And we promised them we were going to take care of them. All you have to do is go to Kensington and Allegheny to know that what was historically a poor community that has always had drug problems, but nothing but what like we've allowed to fester there. I'm really concerned when we start talking about best practices. Councilman Green talks about this move to medical assisted treatment and it being evidence-based best practices. I'm usually not a conspiracist, but the pharmaceutical industry created this problem. Now they spent millions of dollars on studies to tell us they can fix the problem. That we will now give them billions of dollars to, for the rest of their lives, have people on their medications to counter what they did when they addicted them in the first place. Folks, I'm usually, and I said this a few months, 18 months ago or so in this council, I knew this conversation around the safe injection site was coming. And if I've said from day one, if this is a medical intervention, it has to be in a hospital. If this is a practice that this administration wants to support, what made the needle exchange program successful, and I've had this debate on radio with Governor Rendell, you lead it, you own it, you accept liability. You don't do an arm's length and put a nonprofit of very well-intentioned people that I have the highest respect for. Jose Benitez is my personal friend, and we have not always agreed on everything, but I've always listened. In the last 6 months, we've spent time in Kensington trying to get folks motivated around what we agree as we restore Kensington. We've had advocates on both sides of this talk to each other, listen to each other, and I feel like all of the ground we gained around understanding was blown up because one or two people decided I'd rather beg for forgiveness than ask for permission. This is disrespectful. It is disrespectful for an administration that continuously talks about Trump and how the federal government is disrespectful and has lost its humanity, and we do the same thing. Whether it's the Northeast, whether it's South Philadelphia, whether it's Kensington, people deserve a process. They deserve to have every question answered. Will a pregnant woman be allowed to go in there? Will a minor be allowed to go in there? Will people be allowed to leave fully drugged and get in a car and drive away? People have the right to listen to those answers. They may not agree with us at the end. And Councilman Squilla and I know most of the time, 80% of the time, they don't agree. But we've respected them, we've respected their role in the community, and we have allowed them to ask those questions. And ultimately, again, focus people on the part that we agree. I have been told I have blood on my hands. I've been told all of those things, and we've moved away from that discussion. We've moved to a discussion about, in all of these services, methadone clinics. I get tweeted that I'm the methadone queen because we have methadone clinics in our community that I have supported because 60% of the folks who visit it live in that community. So that is not someone coming from outside, that is your neighbor who is going for services. We need to be able to talk to our community about the reality of this is lifetime recovery for folks, right? But now we tell them you can't smoke in recovery. Now we tell them you have to take MAT. It's contradictory messages. And so over the next few weeks, everything that we've gained over the last few months has gotten blown up. And you're going to see divisions with a racial undertone that is extremely dangerous when you have a president that we continually talk about who has divided this country. Be a leader. If Dr. Farley and Mayor Kenny want this, own it, lead it, fund it, accept responsibility. Do not use Safe House and a board of private citizens, all who are very well-intentioned, take all of the responsibility for this. Do not say that it's an arm's-length relationship. That is not leadership, and that's not going to bring people together. It's going to create the kind of division that we've seen over the last 48 hours. People of Philadelphia deserve better. This work is going to take us years. We have a decade of restoration that we have to do in Kensington. This is not going to be successful. The run to be the first is also the run to be the worst. It is not going to help people in addiction. It is not going to help our communities destigmatize a lifetime journey for folks who have a mental health disease. You have blown up all of the goodwill, all of the credibility of the stakeholders and the advocates on both sides of this aisle. I call on Safe House. Don't put yourself in the middle. Do not lose all of your credibility around AIDS work, needle exchange work, all that we've been part of, that I have been part of for 20 years, even before getting into council, for the race for the first. The residents all over the city deserve better. If eventually this becomes a model that we want to adopt all over the city to take care of our residents, let it be one where there is a process and there is respect and humanity in the discussion. Thank you, Council President.
Thank you, Councilwoman.